most of snowboarding injuries are upper extremity injuries.
Exactly. So primarily forearm fractures, shoulder injuries, shoulder separation, AC joint.
Welcome to the Motion Lab, the podcast that explores the science of movement and helps you live a stronger and healthier life.
All right, welcome back. My name's Chuck Dowell. I'm one of the PAs here at Colorado Springs Orthopedic Group. I'm here with Darin again.
I'm physical therapy supervisor down here at Colorado Springs Orthopedic Group.
So we thought it'd be good to do a video and or a discussion on ski and snowboard related injuries. We're in the middle of ski season. We're in Colorado. Skiing is huge here. And as we transition into this colder weather in the ski season, in the orthopedic clinic, we tend to see a lot of common injuries regarding both skiing and snowboarding. And there are some preventative measures that we can do to help reduce the risk of these injuries. So we thought we'd have a discussion regarding what these injuries are that we commonly see and potentially how you can prevent them. So what are you seeing in the physical therapy clinic as far as common injuries?
So with skiing, typically we're seeing something related to the knee.
Yep.
Most commonly ACL injury, just based on the mechanism of injury with those ski accidents. Other thing we're seeing a lot of is shoulders, usually related to a fall.
Yep.
On the snowboarding realm, a little bit less knee, more impact-related injuries. We're seeing concussions, forearm fractures, shoulder fractures, just impact-related accidents from going down on a snowboard. You'll occasionally see a knee injury in more advanced snowboarders impacting the ground again.
Yeah, I think it's interesting, from an orthopedic perspective or an orthopedic urgent care perspective, we see a lot of ACL injuries typically in fall sports because that's when sports pick up and you have football, volleyball, sometimes basketball going. But honestly, one of our busiest times of the year for ACL injuries is ski season. And that's because the lever arm that's created by the ski creates an extra rotational force to the knee. And oftentimes when we're falling, that rotational force causes an injury or at least a ligamentous injury to the knee. Most commonly, that ligamentous injury is the ACL. Sometimes it can be the MCL and the meniscus as well. Yeah. And so if you look at the literature, somewhere between 40 and 70% of ski injuries are typically lower extremity injuries, and 40 to 50% of those are usually related to the knee. When I first started in my career, we had a lot of fractures of the tibia that happened, but as the bindings have kind of developed throughout the years, we've reduced those tibia fractures, and now these knee injuries are more common. And unfortunately, the development of the bindings weren't developed to reduce the stress on the knee.
They're going a long ways in the ski industry with kind of pivot bindings to help reduce that stress on the ACL.
Yeah.
So they're trying, but it's just there's no way to fully prevent it.
Yeah, I think that's what's happened is the original bindings came out to reduce these boot top tibia fractures, and that was kind of one of the purposes of having them. So if you have or the bindings feel a torque to the knee or the tibia, they'll release, and then you won't have that rotational force that'll cause the fracture. And now we're trying to develop the bindings that can now reduce the rotational forces to the knee to potentially reduce these ligamentous injuries. But some of those ligamentous injuries are unavoidable. Sometimes you hit a patch of ice, sometimes somebody cuts you off, it's bad weather, but there is some inherent ability to avoid those injuries. And so I thought it'd be good to talk about potentially how can we avoid maybe knee injuries or lower extremity injuries with skiing. What do you think are some of the best ways we can do that?
So warming up again, we've talked about it before, doing some kind of dynamic warm up the tissues before you get on the mountain. I like to say do it before you put your ski boots on. Because if you're sitting there doing some leg swings in the parking lot and you slip and fall, well, it's going to start your day off pretty rough.
Yeah. Won't even start the day.
Yeah. So doing some kind of dynamic warm up.
Yeah.
In the parking lot ahead of time.
Yeah.
Just to get everything ready to move. And then we got some exercises we can go through as far as strengthening and building some stability and proprioception around that knee joint, around the ankle joint.
I think one of the biggest things is that we all try to prepare for sports and athletics. We all try to prepare for ski season. In October, we start to kind of develop our musculatures and say, hey, can we get strong for ski season? But life is life. We're all busy. We have kids and responsibilities and work and things like that. But sometimes putting a short duration of a program into implementation can be helpful. There's good literature that shows that if we could strengthen our lower extremities and improve our dynamic stabilizers, we can reduce the risk of ski injuries or lower extremity injuries.
Exactly. So it's a fancy word called proprioception. It's basically receptors in your joints that tell that joint where it is in space. So it lets you know if you're shifting forward, sideways. So building that up kind of inherently builds a foundation to kind of stabilize your knee without having to think about it.
Yeah, and I think that's like your body's self-defense mechanism to know if I'm gonna be injured and how can I prevent the injury. So if you're falling and skiing and your body senses that I'm getting a rotational force to the knee, it'll fire certain muscles to kind of correct that. And if your mind muscle kind of development's not there, which sometimes takes a little bit to develop, that may not be there to correct it, and you're at an increased risk for injury. So that's where we can do specific exercises, develop that proprioception, so then we can potentially reduce that risk. We also discussed, me and you were discussing before we started, that despite having two skis on, skiing is a very single leg activity, and a lot of us do squats in the gym and develop bilateral leg activities, but we don't develop this single leg activity, which often increases our risk of injury as well.
Definitely, you never know. One ski might catch a patch of ice, slide out, you're left stabilizing on one leg. Also, every time you turn on skis, you're unweighting that uphill ski, driving weight down through that bottom leg. So there is a lot of single leg component with skiing.
Correct. Yeah, I mean, they describe that kind of shadow foot mechanism of injury that you can happen. So as he said, that unweighted upper leg, that rotational force to the lower leg. And so a lot of the times your arm will be behind you and you'll kind of have that torque force. So they say, for falling, if you can keep your arms together and kind of fall with your arms together, kind of try to push, your feet together, that will reduce the risk of injury to the knee. And so I think a lot of those things are good things to practice and or kind of keep in mind.
That's where we see a lot of the shoulder, thumb injuries too, or you get it kind of outside that base, rotating, sticking an arm out, catching your thumb on a pole, something like that. Those kind of injuries, there's not a whole lot of prevention, but stabilizing the legs could take a step in that right direction.
So I think the big question would be, okay, so what if I am skiing and I injure myself skiing? When do I know if I should come into the orthopedic group and see somebody, or when can I maybe continue to ski or just ski through it the next day?
So typically, something severe like ACL, ski patrol is going to get involved. People can ski down off of it. If it's torn, you're not going to tear it worse. And if it's torn all the way, you're not going to tear it worse. But I'd say significant swelling that lasts 3 days. So if you do it on a Saturday and it's still pretty swollen, tough to put weight on it, come in and see us on Monday or Tuesday. Have Chuck check it out.
Yeah, like he said, I mean, I think the questions I ask when anybody comes in with a ski injury is, number one, did your binding pop off? Because that tells me potentially how much rotational force to the knee happened. Number two, did you feel a pop, hear a pop, or was there a cessation of that? And number three, could you ski down? If you can potentially ski down and you try to do one or two more runs and you're done, that makes me concerned that it's more of a higher level injury, and potentially that's something that should get checked out. If you skied the rest of the day and it was sore the next day, but you skied the next day, then probably more of a lower level injury. Still can get it checked out, but maybe can try to treat that with 3 to 5 days of rest, ice, compression at home.
Yeah, and it sounds like something like that would be like a partial tear, which you can stabilize, working some of these exercises to try to kind of repair those receptors in there.
Yeah. And one of the questions I get a lot of the times, which I think is a good question maybe to address, is braces with skiing. I think if you have a pre-existing history of a knee injury, or you have some osteoarthritis in your knee, I get asked, should I wear braces or should I not wear braces? What are your thoughts on that?
Typically, I'm not a huge fan of braces because you rely on the brace rather than the muscles around the joint to help stabilize. But this is a little bit different. There's a lot of different components that could impact your knee that you can't control. So if you have a history of ACL injury, I say wear the brace. If it's pretty stable and you feel good, you can wear something like a sleeve brace. Doesn't give as much support. If you're still real unsure and unsteady, like a hinged knee brace, something that gives you a little more of that medial lateral support, could go a long ways to just stabilize the knee and protect you a little bit.
Yeah, and it's interesting, there's actually some pretty good literature that shows that something as simple as a knee sleeve will actually improve your knee's proprioceptive capabilities. And so that's often what I recommend is, the bigger, bulkier hinge braces, the post-op ACL braces, the, functional specific ACL braces, I don't usually recommend, but a lot of the times I think a knee sleeve will improve your knee's proprioception, potentially reduce injury risk. plus you're getting some compression, some warmth there, which will reduce that arthritic flare type risk. So that's what I usually recommend.
We also have upstairs here like a sports brace for post-op ACLs, which a lot of people will use for skiing, basketball, different sports activities after ACL repair.
Yeah. We'll briefly mention the upper extremity and the skis, and then we'll go to snowboarding. So you mentioned the thumb injuries. So thumb injuries can happen secondary to ski pole accidents, right?
Yeah, plant a pole and just kind of twist around it funny.
Shoulder injuries can happen secondary to falls. So if I fall on my shoulder, I can get an AC joint injury or a clavicle injury. If I have an underlying history of maybe some rotator cuff things, I can injure that rotator cuff as well. So similar as we talked about, maybe if you have some limited motion, some limited strength afterwards, come and get checked out.
Definitely, yeah. A couple of visits, come up with a rehab program to try to restabilize that shoulder.
Yeah, and I think exercises for the shoulder can also help to reduce the risk of injury to that as well. So if you have a known history of some shoulder injury, you could potentially do some exercises, go see the therapist maybe before ski or snowboard season, and strengthening that shoulder will improve those dynamic stabilizers as well.
100%, yeah.
And then on to the snowboarders. We don't want to forget about you. Actually, interestingly enough, the injury risk in snowboarding is significantly higher than skiing. And as we were talking about, most snowboard injuries happen with beginners, right?
Exactly. Almost 50% is beginning snowboard levels.
Yeah, and that's because we fall a lot when we're learning to snowboard, right? So, I mean, they teach you how to fall, and they teach you potentially the right way to fall, but the natural instinct for all of us is to put our arms out when we fall.
Yeah.
And, most of snowboarding injuries are upper extremity injuries.
Exactly. So, primarily forearm fractures, shoulder injuries, shoulder separation, AC joint, just from sticking your arms out. Other thing we're seeing is head injuries.
Yeah.
So falling backwards, catching that back edge, hitting the head. Same with coming forward.
Yep. So concussion risk is a lot higher, I think, in snowboarding because of the risk of falling than it is necessary in skiing, but also definitely recommend wearing a helmet in skiing. I think if you're doing the parks and things like that, spinal injuries, concussion risks are much higher because it's a higher dynamic activity. We were talking about this, and I think some of the literature shows that actually those braces for snowboarding can significantly reduce your risk of wrist injuries. You had mentioned it's not cool to wear braces, which is true. Like, nobody wants to wear them and have their friends kind of like say, hey, why are you wearing those? So I was saying that there's actually gloves that they make now that have the braces built into them. And if we know that it will reduce your risk of injury to your wrist by 85%, I think that's worth wearing, because the last thing you want to do is go out there and start to learn how to snowboard, and your second run down you fall and injure your wrist, whether it's ligamentous or break the bone, and then you're kind of done for the season.
I had a friend, she was a ski instructor, phenomenal skier. First run on a snowboard, caught an edge, snapped both wrists.
Yeah,
so it happens.
It happens a lot, and that's why one of the major risks of snowboarding is the upper extremity wrist injuries, and if you can wear those braces, I think that will help. We had mentioned, so the other things like in ski injuries that you can have with snowboarding is if you fall directly onto that shoulder, the AC joint separation, the clavicle injury, or injure that rotator cuff.
I mean, primarily upper extremity. We're seeing some knee, not to the degree of skiing, but more ankle injuries also.
Correct.
So the snowboard boots,
Yep.
a lot more mobile, not as rigid as a ski boot, so you have a little bit more torsion on the ankle, high ankle sprain, stuff like that.
Yep.
As you shift forward, you can kind of get extra pressure on that tib-fib complex and create a high ankle sprain that way.
Yeah, so I think as he mentioned, the knee injuries are slightly different because your knees are kind of stuck to the board. So a lot of the times that's more collateral ligament injuries, MCLs, sometimes meniscal injuries from kind of falling back on a twisted position. And then as you said, I think we see a lot of these ankle injuries, outside ankle injuries that can sometimes happen and sometimes are missed, at least in the urgent care clinics or family practice clinics, because they're very subtle on the exam findings. And so similarly, I think, are the exercises different, would you say, from a prep for snowboard season than a prep for ski season?
Very similar.
Yeah.
I'd say it's still, like we mentioned, a lot of proprioceptive, dynamic exercises. Snowboard, both feet work in tandem a little bit more versus you get more single leg activity with the skis. But most injuries, about 75% of ankle injuries, are that lead foot.
Okay.
So if you're riding regular, it'll be your left foot. Riding goofy, it'll be your right foot.
Okay.
But that lead foot tends to be the one that suffers most of the injuries.
And I think snowboarding is more a dual leg balanced proprioceptive activity, right?
Definitely,
I've never snowboarded. I'm too tall, I think, to snowboard. I have a long way to fall. Yeah.
Definitely breaking some.
My injury risk is very high with those falls. But you snowboard, and so you would know better than I would. Do you think those proprioceptive exercises, now we're going to do maybe some single leg proprioceptive exercises for skiing, are we going to do modal, bi-leg proprioceptive exercises for snowboarding?
Yeah, I'd say combining both legs, and snowboarding is a lot more weight shifting versus just balance.
Yeah.
So using both legs in a stability point with some kind of external force, be it a band, a ball, something like that would be a good prehab for snowboard season.
Yeah. So, we thought it would be good to kind of have a discussion regarding injury risks and common injuries that we see in both the ski and snowboard athletes. In the orthopedic clinic, especially this time of year, we do see quite a bit of them. There is some preventive nature, whether you can do an exercise program beforehand, during, warm up, as you said, I think is very important.
Definitely.
I think as a physical therapist, when you pull into the parking lot at a ski resort and you see somebody doing leg swings, you just smile, right?
They've been there, they've done it before.
You're like, that's one of my patients. They're warming up, they're reducing their injury risk, I can see what they're doing. Or if you see somebody doing a couple air squats to trying to warm their knees up, I think we in the orthopedic community smile because we know that's not somebody we're necessarily going to see later as far as an injury risk.
Yeah, definitely.
So I think these are small things that we can do, but huge things that we can do as far as reducing our risk of injury, warming our joints up, allowing us to have a good vacation, to participate, to be able to have a full ski season without having any injury risk. But if we do have a risk of injury, the orthopedic clinic, we have the Express Care, which is a walk-in clinic open 9 to 5. We have the physical therapy clinic, as Darin said, where you can come in and maybe do some of these prehab exercises.
Definitely. Yeah, you can see Chuck, get a referral, pop into the clinic. Just say you want to set up a PT visit if it's simply to get some exercises to work on at home or rehab from an injury.
Yeah, I think a lot of the therapists do winter sports, ski and snowboarding activities, so they're very familiar with the appropriate exercises to do. Sometimes it's just one or two exercises for them to show you the right way to do them and the appropriate technique to do them, and then you just do it at home on your own, trying to prepare for the season. Or if you do have a minor injury and you want to rehab that injury to get back for the season, a lot of the times they can help you with that.
Yeah, I think every one of our PTs, PTAs skis or snowboards.
Yeah, and we were talking about this. It's funny, I get asked a lot if I ski because I see these injuries a lot, and I was saying anecdotally I don't anymore. I stopped skiing because I had young kids, and now I see injuries all season. And every time I think about it, I say, I'm not sure if I want to go up there and risk my injury risk with how tall I am, and I haven't done it for a while. But we'll see. Maybe I'll get back out there.
I'll take you up one day.
Yeah, you'll have to take me up. It'll be all greens. Yeah, I'll be the bunny slope the whole time.
Yeah, follow me.
And I think that last thing that we can mention, which we talked about, is skiing within your means, right? Definitely. A lot of injuries happen at the end of the day. A lot of injuries happen because maybe I tried to overski and that got me into a position. So I think skiing within your means is a big thing.
Yeah, fatigue, end of the day. Just be extra careful of those runs. And a lot of it's other people on the mountain.
Yeah.
So try as best you can, keep your eyes out, keep your eyes downhill for anyone making a traverse in front of you.
Yeah.
Someone you might not see, coming in around the side. Just be aware of everyone else on the mountain because that's typically where most accidents occur.
And that's probably why a lot of things occur in the beginning athletes or the beginning skiers is because you're so focused on your form and your technique and your muscles and your balance, you're not peripherally aware of things around you. And if somebody cuts you off and you're not able to correct that, and in more advanced skiers, their injuries happen because they're doing high level of, moguls and black diamonds and parks and things like that. They're confident in their technique, but those other factors then play into that.
Yeah, that's where you're going to see the impact injuries. Yeah. The twisting, catching rocks, trees, ice, stuff like that.
Yeah. Well, we appreciate you. Thanks for joining us. Anything you want to add?
Nah, stop in and see us if you have any questions.
And we're hopefully going to do some of these continually, maybe do some injury risks as far as golf. We both play golf. We love that. As the soccer season comes on, ACL prevention is huge with soccer. We do some ACL prevention as part of an organization with CSOG, and I think that can be quite helpful. So we'll do something on that and whatever else comes up.
Yeah, leave any comments if you want us to talk about something specific, we'll see if we can try to address that.
All right, we appreciate you. Thank you very much.
Thank you. Hi, I'm Darin from Colorado Springs Orthopedic Group. We're going to go through a couple exercises here to get you warmed up for ski and snowboard season, as well as some exercises to help with that strength and injury prevention measures to get you ready for the season. So the first warm-up, again, I like to do a dynamic warm-up here. So the first one we're going to start with is just a high knees. So just kind of alternating, bringing those knees up to 90 here. You can use the hands, or you can keep them down by your side and kind of pump the arms a little bit. So the next one will kind of stretch out and warm up the back of the leg. So I call them toe kickers. So just alternate, lifting that foot up towards the hand. Squats are always good for warm-ups, but we're going to add a little bit more dynamic capability to it here. So we're going to do a squat with a jump. So we're going to squat down, up. So work on that explosive movement just a little bit more. Get the calves involved a little bit. And if you can't jump, give me a squat, come up on the toes, back down. All these obviously doing before you put your ski and snowboard boots on. Next one, we're going to do a curtsy lunge. So we're going to step back, coming down, back up, alternating side to side. So reaching that back foot slightly across and back, coming back up. And the last two warm-ups are more for our snowboarders. So there's some heel and toe walking. So toes up, staying on those heels, coming forward, back, and then same up on the toes, doing some steps forward, steps backwards. First one, we're just do a simple wall sit. So back against the wall, feet out in front of you, and you're gonna slide down the wall, low as you can tolerate. The goal here is to get to 90 degrees parallel to the floor here. We're gonna hold for about 10 seconds. And then we'll slide back up. Perfect. If going down that low hurts the knees, go a little bit lighter, a little bit shallower angle. Take some of the stress off those knees. Still hold. The hold at 10 seconds is too easy. You can always increase it 15, 20, 30 seconds. So for the next couple, we're gonna add in this TheraBand here. So we're gonna take the band, we're gonna slide it down around the ankles. All right, so the first one's called a monster walk. So we're gonna keep feet about hip width apart. As we step, we're gonna make an in and out motion coming forward. So stay in a slight squat position as you come forward, and then same going backwards. Good. So again, we're gonna make like a small C coming in, stepping out, and out. Don't let those feet get closer together as you go. Make sure you keep a wide stance as you step. So next one, we're gonna slide the band up to our knees here. So with this one, we're gonna stay in a slight squat position here. We're gonna hold stance on one leg. We're gonna pull that one out to the side. So staying in that squat, pulling one leg out. It's gonna work these hips. It's gonna also keep these quads engaged the entire time. So 10 one leg, 10 on the other leg. So I also talked about working on that proprioception. So a lot of that's related to balance. So the first one I'm gonna give you is called a single leg deadlift. So we're gonna stand on one leg. This leg has a slight bend in the knee, and all the motion comes right here at the hip. So coming forward, down to the floor, back up. So we're gonna try to not put this foot down in between. If you need to, kind of catch yourself for balance, but motion right here at the hip, coming towards the floor, back up. So again, slight bend in that stance leg, if you can see it here. Motion comes right here at the hip, coming forward to the floor, back up. Trying to stay flat across the back. The next one for balance, standing on one leg. So we're gonna stand on one leg and we're gonna do what's called clocks. So we're gonna hold all your balance on one foot here. You're gonna reach forward, back to the center, out to the side, back to the center, and then backwards, back to the center. So make sure you're staying on that one foot. You're not stepping, you're tapping, coming back. Tap to the side, coming back, tap backwards. So here, Harder it gets, go out further. One more dynamic movement we're gonna do here, and then we're gonna move down to the floor. So call this one a log hop. So this kind of helps those joints absorb some of that lateral motion. So you can set something on the floor. If you want to set your band on the floor here, just to give you a target to jump over. So we're gonna come here, over. There. So jumping side to side catch and go. So try not to get going too fast by leaning. You want to pause, catch, and then go. So core strength is also a huge component in stability and kind of working on keeping those hips strong while we're moving down the mountain. So the first one we're gonna do is called bird dogs. So we're gonna kind of move down to a hands and knee position here. Staying flat across the back. I want you to keep the belly engaged. We're gonna alternate side to side with the arm and opposite leg. So here, there. So slow and controlled, keeping the core engaged the whole time. Let's give you a side view here. So again, back staying flat here. Squeeze the abs. Opposite arm, opposite leg. All right, next one we're gonna move into is a single leg bridge. So I'm gonna give you a front and a side view of this one. So laying on your back, knees bent. We're gonna kick one leg straight, parallel with your bent knee. And we're just gonna lift up and back down. So coming until you're kind of a flat plane and back. With this one, keep the head and neck relaxed on the floor, coming up. So let's do a side view here. So leg out straight, other knee bent, up, back down. And our last one, we're gonna do a plank variation here. So it's a plank with a little added movement to it. So to start our plank position, we're gonna go on the toes and on the forearms. So here, squeeze the belly here and keep yourself flat. That's our start position. So we're gonna call them up downs. So we're gonna go up, up, down, down. We're starting our plank position here. So staying flat. I'd rather you slightly arched versus dropping here. So try to keep you relatively flat, coming up and back down. Work on these exercises to help with injury prevention, improving that strength, and getting ready for that ski snowboard season. We look forward to seeing you here in our next video. If you have any questions, feel free to contact us here.